We're going to talk about, am I a failure if I take medication for my weight? I'm Dr. Robin Pashby. Dr. Kelly Donahue will be chiming in a second. So this video is being recorded. However, the recording will not reveal any participant information. We've doctored up and done the magic of Zoom to protect you. That's why there's no video. There also will be no chat during the talk, and the recording will be stopped prior to the Q&A session. So the Q&A will be done only via chat, and the chat is actually restricted to the participant and host interactions. If for any reason you don't want others in the room who can see your name, to see your name, you can rename yourself by clicking in the three dots by your name and then just clicking rename. So you can rename yourself. There's no need to unless that makes you feel more comfortable. So again, no video, no chat for your privacy. Okay, and then just a brief disclaimer. So this presentation is a discussion and it's for information purposes only. So it's not medical advice. And while Kelly and I are both licensed clinical psychologists, we're not conducting therapy or acting as your therapist during this session. But we can provide you with a variety of resources following this discussion if you reach out to us at the end, and we'll be happy to give you our information. Most importantly, we created this space to be supportive and educational. This is not a forum for debate, for judgment, or for criticism of a choice that a person makes about his, her, or their weight or health journey. Okay, so with that in mind, let's talk about why we even decided to offer this series of Q&A type sessions. Basically, Kelly and I, week after week, month after month, kept realizing that the most common mental or emotional health considerations we were seeing in our clients overlapped. They included shame around needing to consider one of these or considering one of these, because of words that the media are putting out in the world, like this is the magic sauce, this is the celebrity weight loss secret, and those sorts of situations that create in us this feeling that this is something that shouldn't be for us. Most people that we talk to also have friends or family or coworkers or people like that in their lives who don't understand the journey of dealing with long-term chronic health-related issues related to weight. So we wanted to create this series of Q&As to, number one, normalize this, and number two, start to try to eradicate and erase that shame. People also feel tremendous failure for using or considering using one of these obesity medications, and partially because of those shame that society has. We also realized that people were experiencing a lot of perfectionism related thinking when they would start one of these medications, feeling like, oh, I need to, quote, make the most of it, or feeling like they really needed to be on top of their diet. This could trigger any sort of disordered eating history that a person may have. So particularly the regular self-weighing, the monitoring of eating, those types of things can be really triggering for people. And then there's a lot of potential here for depression and anxiety symptoms, right? Someone who's a low responder or a non-responder might feel like they put all their eggs in this one basket after struggling for decades in some cases. People may have difficulty sourcing the medication and therefore may feel a lot of anxiety around getting it. And then fear of regain. What if this stops working? Or what if it actually works? So we're going to get to those in a moment. Very briefly, there are lots of anti-obesity medications now. The ones that we are mostly talking about during this presentation are the semaglutides and the tirzepatide. And basically, we want to let you know that this is a very helpful chart. We're not going to go through it. This is not a physiology lesson, but it helps to highlight that this is not all in your head. Okay, this is not just about willpower. This is some of the mechanism of action that occurs with the GLP-1s or the GIPs. So the GLP-1s are found in drugs Ozempic and Wegovy, which are actually the very same drug. They both contain semaglutide, as well as Rybelsus, which is a orally taken semaglutide. And GIP is combined with the GLPs for tirzepatide, also known as Mounjaro. And these target all these different pathways to affect things like appetite, cravings, the sensation of feeling full, person's food preferences, their blood sugar, but as well as their thoughts about food and decreased reward from food. So this is not all in your head if you're experiencing some positive impact from this. But speaking of in your head, I also thought it was worthy, because we're psychologists, to tell you that GLP-1s are actually also being investigated for their role in the treatment of depression because of their impact on inflammation, the crosstalk between our gut biome and our brain, and other things. So just as sort of a reminder that these are very powerful medications. And we are going to review some of those mental health things that have come up in the form of this Q&A session.
All right, that brings us to our first question. And hello to everyone. I'm Dr. Kelly Donahue, happy to be here this evening. So the first question, and again, we get these questions from many of our clients, which is why they're so relevant to our presentation this evening. So the first one, if I start one of these medications, what does that mean about my lifestyle and my relationship to food? And so the way we would answer this is to say a lot of our recommendations would be the same whether you're on the medications or not. And that includes something you've probably heard us say, which is focus on small changes. These small changes make a big difference. This is not about perfectionism. Having this drug on board, these drugs, medications on board, does not mean that there's going to be any sort of magical change. We still can't shoot for perfection. We have to focus on small, steady changes in our nutrition and in our movement and exercise. We also would say the same thing about your environment, creating an environment in your home or workplace that is friendly to healthy food. And when we talk about environment, it goes further than that to your relationships as well, which is why we're so excited to also to be able to talk to people in the lives of people taking these medications so that we can help create a more supportive and understanding environment. We would also still encourage people to work on mental health. As Dr. Pashby just mentioned, we're learning more and more about the connections between these medications and mental health. And I have a feeling we're just scratching the surface on how mood is connected. And then finally, we also always talk about sleep and stress and the importance of good quality sleep and reducing stress for weight loss and weight management. Now, here comes the slight differences. So when these medications are being taken, we have seen possible improvements in stress and anxiety about food and mood, again, as Dr. Pashby just referred to that previous study, and also improvements in cravings and desire to eat, both reducing cravings and even craving healthier food and just not being so focused on food. Also, this feeling of being ready to engage in lifestyle changes that you might have had in mind for a long time or have been trying to do, but just hadn't been able to get there.
So moving right along to question 2, I feel so much shame in even considering one of these anti-obesity medications. Can you help? So this is something that we face every day with our clients, people who delay care, people who are afraid to talk about it if they are trying one. And so there's really no more clear and blunt way of talking about this other than the fact that obesity is a complex chronic disease for which you deserve treatment. That's it. And I know that it sounds so easy to say, and it's yet so complicated because of decades and decades of bias and society's stigma and your own internalized stigma, right? Weight bias is everywhere, externally in our lives where people are judged more harshly for their body size, told to just eat less and move more for many, many decades, maybe by family members for your whole life. But also that stigma becomes internalized, right? So we then believe that any help or assistance we get in working toward weight management is a cheat or a failure. And so that really is a reflection of this internalized weight bias. Many of you here, I hope, would not feel that same way around treating another chronic condition like diabetes or like asthma. You wouldn't feel like it's a cheat to get an inhaler to help you with your asthma, I hope. So I think where society gets this confused, and the media is a perpetuator of this in many cases, is that these medications are not get thin pills, right? These are not magic pills or magic sauce. These are really medications designed and approved by the FDA to treat the complex and chronic disease of obesity. Not only that, but we live in this environment that is full of processed and engineered foods that are designed to basically encourage us to overeat, right? That create this sort of addictive pattern of eating. And so we live in this environment full of bias, full of addicting foods, and here we have this problem. So what we encourage people to do is recognize that obesity is chronic and complex, recognize that weight bias is the likely cause of the shame that you feel, and then do the work. Rally your support from your loved ones. In June, we're going to actually have a talk just like this aimed at your support persons or person. And then also use CBT. So what are the thoughts that you have that are contributing to that feeling of shame? We're going to talk in July about a sort of a quick and dirty CBT-based behavior and cognitive change for working alongside these medications. So we hope you'll join us for those too.
All right, now moving on to question 3. Do these medications make it easier to change my lifestyle patterns? The truth is that they may provide more cues about hunger and fullness, meaning that you're more likely to be able to notice when you're actually hungry versus eating for other reasons, and more likely to notice when you're getting full. And for some people, this is surprising that they're actually feeling full. Also may cut down on food chatter. But remember, behavior change is still not easy. So even if the thoughts in the brain about food are being cut down a bit, you still need to make those behavior changes. And that involves keeping your expectations realistic about what is possible. Some people do find it easier to make changes they've been wanting to make for years because they're less driven by needing food or certain kinds of food. Weight loss can make the healthy changes that go along with a healthy lifestyle more accessible, like sleep and movement. And this turns into an upward spiral. We often talk about the downward spiral in which negative thoughts lead to negative behaviors, and that can lead us to feel more depressed or more anxious. But in this case, weight loss can actually be an upward spiral that helps us to be healthier. But still, there is a need to focus on these small changes. And this is not an all or nothing perfectionist approach.
We also get the question a lot, question 4, what happens if the meds don't work for me? Or what if they do? Now, if the meds don't work for you, I just want to leave you with one word. If you remember nothing else, there's hope, okay? You are not a failure if your biology does not respond in the way you expected or hoped in response to these medications. But it is disappointing. With all this media hype, how could it not be? And so what we want to remind you are a couple things. Number one, if they don't work, that doesn't mean there's something wrong with you. It doesn't mean that you are a failure, okay? But you should remember that other medications are in the pipeline. They are coming. Okay, I just attended the Obesity Society annual conference a few months ago, and they outlined multiple medications that are in various stages of clinical trials where we are really getting closer to being able to be more specific and more individualized in our approach to medication treatment. Also, if you are working with an obesity medicine physician or a well-trained primary care physician, or a behavioral health specialist like Dr. Donahue or myself, someone who's really well-trained in anti-obesity medications, you may be interested in learning more about combination therapies, right? So many people who are not well-trained might not understand how to use these medications in combination, but I've seen it very successfully done in my practice. No matter what though, right? If they don't work, it still means that you need to monitor in an ongoing way and assess the physiology and mental health that is associated with your weight and health. We also, of course, encourage you to come to our next meetings so that you can continue to get the support that you need. Okay, now that's what happens if the meds don't work for you. Now, if the meds do work for you, basically the same thing, okay? Number one, you are not a failure, and you're not a failure for needing a medication to help you on this journey, right? So we have this amazing capacity as humans to take whatever outcome is at hand and blame ourselves, to tell ourselves that we are the cause. So I just want to highlight for you that you are not a failure either way. And also to remind you that other meds are coming, because sometimes people develop a metabolic adaptation to some of these doses of medications, or they develop side effects or other things over time. So remember that other medications are coming. Similarly, remember that a combination therapy is a very viable thing to consider if you're working with someone who is well-trained and well-versed in discussing how to use these medications. And also, we very strongly encourage you to monitor your ongoing physiology and mental health, and of course, to come to our future meetings.
And the fifth question that we also hear a lot is, what does the research tell us about long-term use of these medications? So medications in this and similar classes have been used for many, many years for type 2 diabetes. And there are initial studies like the STEP trial that are very promising. And the STEP trial is over a year long, which they follow participants. So that's a fairly good length of time. However, they haven't been studied in the long term, and they haven't been studied extensively on all different types of populations. So we still have a lot to learn about the long-term use and side effects, and also about psychological and behavioral impacts. And with more advances in medications, I think we'll also be seeing more and more studies that are going to be focused on these areas. So this was just a taste of what we have to come. Over the next several months, we'll be hosting one of these Q&A sessions each month. So in May, we're going to talk about what it's really like to take these medications, and we'll have a panel discussion with people currently using the GLP or GIP medications. And so this is important if you are taking the medication, want to understand what others are experiencing, or if you're just considering potentially taking one of these, kind of get someone on the inside to tell you what it's really like. And then in June, we're going to move on to I love you, but I just don't get it. This will be a Q&A session for family, friends, support networks about the use of these medications. Oftentimes people who don't struggle with a chronic condition don't understand the chronic condition, and it can be very helpful, just like with cancer, diabetes, to have support groups for loved ones as well. And then in July, we're going to shift to talk about mindset shifts and behavior change. Again, we talked about how it's important to not throw those things out the window with the use of these medications. And this will be a Q&A about those CBT tools that can continue to support you on your health journey while you're using these medications for weight loss.
Okay, so with that, Dr. Donahue is going to open the chat so that we can use the chat for the Q&A section of our discussion. We have about 9 minutes left. We designed it intentionally to be concise so that you would have an opportunity to just chat us any questions that you have, and know that the chat question that you write only goes to us. It does not go to the other participants in the room.